I'm Dr. P.C. Gupta, Chief of Vascular Endovascular Surgery, Interventional Radiology and Podiatric Surgery at Care Hospital in Banjara Hills, Hyderabad. When we talk about the vascular system, we generally talk about veins, we talk about arteries, but there is a third system which people tend to forget, and that is the lymphatic system. With me, I have Dr. Radhika, who is a plastic surgeon, also trained in podiatric surgery and trained in management of lymphatic diseases. So today we will talk to her about what are lymphatics, lymphatic diseases, and how we diagnose them, how we treat them. So Dr. Radhika, to begin with, can you explain what is the lymphatic system?
Yes. As you rightly said, we all talk about mainly two systems, arterial system and the venous system. Lymphatic system is like an underwater sewage plant for any apartment or a building construction. So arteries bring in the blood, veins take away part of the blood. Some amount of water or the fluid leaks out from the arteries and remains in the tissue. This is taken care by the underwater sewage system, which is lymphatics. So lymphatics carry about 60% of the water back to the heart. So whatever water seeps into the surrounding tissue, it is carried away by lymphatic tissues, lymphatics, and then they go to lymph nodes and ultimately they drain into the venous circulation.
Okay, so it would be right to say that if the lymphatics were blocked, then this water would remain in the tissues, for example, in the legs, leading to swelling?
Yes, sir. Yes.
Okay.
What happens is not only the fluid, the proteins also which leaks into the surrounding tissue stays there and they doesn't go back. That's why all this hardness we see with lymphedema.
So as you mentioned, the commonest problem that we in our department see associated with lymphatic system is lymphedema. And as we discussed, when the fluid is not drained from the legs because the lymphatics have a problem, that is when lymphedema develops and people get swelling in the legs. So how does a patient come to us with lymphedema? What are the common symptoms that such a patient would have?
Yes.
And how would this edema or swelling be different from other swellings?
Yes. Usually swelling can be seen because of many reasons. Some people who have cardiac issues or the renal issues, they do also have the swelling, which is different from this. What happens in cardiac and the renal is most of the thing is fluid rather than protein-rich fluid.
Yeah.
It gets drained off easily, but the lymphatic fluid which accumulates when there is lymphatic disease, that doesn't get drained out easily. So it affects the surrounding tissues and it doesn't get relieved more often with rest and lung elevation.
And I think for most systemic problems like kidney and heart or liver associated swelling, it would usually affect both the limbs.
Yes.
Whereas lymphedema could affect one or both.
Yes.
Another thing that I would like to highlight here is that one of the causes of swelling is also venous disease.
Yes.
It can be chronic venous disease, it can be deep vein thrombosis, but a lot of people associate primary varicose veins with swelling. Primary varicose veins do not cause swelling. So if you have varicose veins and swelling, we need to find out why you have swelling. It's not because of varicose veins. Moving back to lymphedema, what are the common causes of lymphedema or who gets affected by this disease?
Yes. Lymphedema, whenever we see, it is usually of two types. What we call as primary lymphedema and secondary lymphedema. Primary is when the lymphatics doesn't form, which is a congenital lymphedema, or the lymph nodes, which are the lymphatic stations, are not formed. So it is usually seen in children or in the young adults. And sometimes it can be unilateral or about 10% they are bilateral also. Primary lymphedema. Secondary can be mainly because of previous cancer surgery or radiation or any previous trauma which affects skin and lymphatics more, like degloving injuries when we see, and previous infections which would have blocked the lymphatic system. And more commonly in India is endemic to filarial disease, which affect the lymphatics and lymphatics get blocked, resulting in secondary lymphedema.
Yeah, I think for most lay people, when they have lymphedema, it is invariably according to them filariasis, whereas filariasis is actually one of the causes of secondary lymphedema. And remember, when there is a major surgery, major injury, the lymphatics can get damaged, resulting in lymphedema. So when patients present to us, how do we assess them?
Any patient who presents with limb swelling per se, we need to see whether it is lymphatic edema or there are reasons for any other reasons for swelling. First, assess them systemically, any cardiac issues, renal issues, and then if lymphedema is the swelling is usually unilateral, then we look for what are the further signs. Look for staging of the disease, like whether the edema is pitting, non-pitting, look at the toes, skin hygiene, any skin cracks, hygiene in between the toes, how are the nails. And after assessing all this, then you need to assess what is the treatment strategy for this patient.
Okay. So when Dr. Radhika says pitting, it means if you press with your thumb on the foot or on the leg, it leaves a dent there because the fluid has been displaced. So that is what we call pitting edema. It sort of leaves a pit. Now, does the treatment between primary lymphedema and secondary lymphedema, does it differ?
Yes. In primary lymphedema, if the patient presents very early, we can assess them and see what we call as ICG lymphangiography or lymphoscintigraphy. We can have a route map or a road map how the lymphatics are. When we assess them, yes, in congenital cases, most of the times lymph nodes are not present. So the treatment differs there in early stages. We can bring in healthy lymph nodes to the affected limb so that that acts as a drainage station and the new lymphatics will form.
I see. So you mean early primary lymphedema can be corrected surgically so that there is adequate lymphatic drainage and person need not suffer lifetime. What other advice do we give to these patients?
Yes. Any patient who presents with limb swelling, few things they need to take care of is swelling should not be there continuously. As it progresses, there might be chances of infection. So to prevent that, usually we start with good skin care, good moisturizing cream, avoid infection in between the toes because that in itself can lead to secondary infections. Good moisturizer to the skin, good footwear, good foot hygiene, and then adequate compression which helps in relieving the swelling. And also we tell them good exercises for the ankle so that some amount of fluid can be drained out. And other thing is what we call as manual lymphatic drainage, where we teach patients to certain type of massages with adequate pressure, so it will help in drainage of the fluid. Other thing which we tell them usually is in the advanced cases where MLD is not working, which is manual lymphatic drainage is not working or not going to help, is lymphedema pump, which is a sequential pump which will help in pushing the fluid from the tissue back into the circulation.
We spoke about protein-rich fluid collecting in the legs. Are these legs prone to infection?
Yes. Whenever there is swelling itself, they are prone to infection. And with lymphedema, with protein-rich fluid, and also their skin will be very dry. So they keep on scratching, and underlying there is lot of protein-rich fluid, which is a good medium for bacteria to grow. That itself, they get infected.
So good foot care, good foot hygiene, good skin care, adequate compression to minimize the swelling that is present in the leg. These, I suppose, would be the key to managing these patients. Very early on, primary lymphedema can be corrected surgically, and we see patients who come very, very late. They have ulcers or the leg is so huge, it's like so much. They can't even lift that leg and walk. So that becomes disabling for them. And they say, you remove my leg so that I can at least walk on the other leg. What are the options for these patients?
Yes. Whenever they come in later stages, what we can do is reduce the bulk of the leg so that the quality of life becomes better. Lymphedema is such a disease which is quality of life limiting factor rather than anything else, even to the patient and to the family. You can do something called excision procedures or debulking, where you remove all that fibrotic tissue. You can spare the skin if the skin is healthy, or if the skin is also affected, you can excise it completely down to the fascia, that is up to the muscle, and then plan for later skin graft.
So lymphedema, while not as common as arterial and venous problems, can be quite debilitating for people who have it, affecting their quality of life. And as Dr. Radhika has mentioned, we have a variety of treatment options, from very simple ones to very complex ones. So if you have leg swelling, especially on one side, or if you come from an area where filariasis is common, or you've had radiation, or you've had surgery for cancer, I think you are one of those who could be having lymphedema. Now, Dr. Radhika, we spoke about lymphedema for the legs. Do we see lymphedema elsewhere, let's say for the upper limb?
Yes, we do see lymphedema in upper limbs, usually post-cancer surgery. That is, for the breast cancer, whenever the lymph nodes in the axilla are removed. It is very common in patients after breast cancer treatment.
And the treatment management would be quite similar with compression and manual lymphatic drainage.
Yes.
So if you have lymphedema, please take care of your legs, keep them clean, keep the skin healthy. Anything else you would like to add, Dr. Radhika?
Main thing in lymphedema management is sticking to the treatment plan. Compliance is the main issue. So everyone feels we need some medication to help this swelling to go down. But the main treatment here is compression, complex decongestive therapy. If you stick to this treatment plan, yes, your quality of life will become better.
So if I were to put it, lymphedema is a disease which in most situations is not curable, but it can be well controlled provided you comply with the doctor's advice, follow up regularly. Your leg should be quite good. Thank you.